I didn't say that in the email, and I didn't say it here. And I said earlier in this meeting tonight that the people in this district know that we are looking at health insurance, and we discussed that in the liaison committee. Everybody knows that that's out there. You know, we've been perfectly honest with our people. That's not being punitive when you work with them to try to achieve a goal. And if we have to go to our staff and say, you know what, we just can't do this, that's not being punitive, that's just being responsible. But if we don't have to do it, and we're just gonna say, we're gonna cut that health insurance, or we're gonna do this or that, with no reasoning behind it, no data, no budgetary implications that we can justify it, then I think it is punitive.
And conversely, I think we also have to remember that parents want the best education for their children, and that's why all of you are here. And so we have to balance out, you know, what has to be cut, what needs to be cut, what's really essential to be cut, and what do we do to keep the education at the level at which it is. I mean, we just heard this phenomenal report about what's going on in the schools and how you people are teaching and how you people are excited about what you're doing, and we also need to remember that in order to balance that scale, we have to help you provide the best education for all of our students and our youngsters in this district.
Steve, I'm glad you brought up the point about the fiscal impact, because I think if we can at least have some of these things out there as potential options, or at least to look at, we're gonna have a better idea when Mr. Milzer goes through the budget. That's why we're, want to do this now in November when he starts putting through the numbers in January to see what we may or may not have to implement. The other thing that I noticed is the district had individual health plan and a family health plan. There wasn't really anything in between. So if there was just an employee with children or an employee spouse, you had to go to the Cadillac to get just the two people covered. Whereas many other options, which I'm hoping is one of the things we're looking at, is you're going to be able to implement at least two other plans, which would be employee child and employee spouse, single and family. So then that will be district savings right there to not have to go right to the family plan when there's levels in between. So some of those savings may offset some of these decisions that would have to be made. So again, it's not a popular topic, and I get it, but I just wanted to at least bring it to the board level, have them look at it, certainly not ask for a vote on this tonight, but at least be able to, okay, here's at least another way of thinking, I guess, is what I'm trying to throw in. Unpopular.
And I think your last statement is a good way to put it, another way of thinking, because you put a lot of people in the room who come up with creative ideas.
And I've used that line, and I support it wholeheartedly, absolutely.
And our consultant is going to bring that forward, and we want to bring that information to those people and to ourselves, so that when we make decisions, we know exactly what we're talking about. It's not based on emotion.
Is Dr. Miller collecting the different handbooks? As we always have done it, kind of in the middle of everybody else, is through the negotiations prior to this, and now getting into this.
We haven't done the handbooks, Jeff. What we've done is we've asked for the information. For example, what do they pay for health insurance, and how many sick days do they allow their staff, and what changes have districts made. So we don't collect the handbook per se. We collect the information that might be within a handbook.
We have to have a package, one, that saves us enough money to operate, but we also have to have a package to keep all the teachers.
I agree.
Now it's an open market.
With the,
before, the teachers really couldn't move around if they had 5 years in. Now they can. So do we offer a package that we can only get the lowest teachers, or do we offer a package that we can keep and still get the teachers? So it's that, where's the package going to be compared to everybody else is where all the other teachers are going to go.
well, and I don't want to, and I don't want to think that, I'm coming in with a guy that has all the answers. I have the fewest answers than anybody in the room. I'm just coming in from a different perspective.
Did you send that to Dr. Miller so she could?
Yeah, as a matter of fact, you beat me to the punch, because I was going to send it to them. I wanted the board to get it first, and then I was going to send it to you and Judy, but your email, but they have it. So, and
to your point, Jeff, just one other thing. I hope we also don't do what any other districts did, because I can tell you that the couple of statements you just made about getting people here in the first place, getting good staff, and then retaining them is critical to this district. If you have turnover, or you have an environment where people want to get out of here and go somewhere else, I think that says something.
Well, it goes back to the negative attitude. If you have a negative attitude in schools, that is going to just kill our schools. And right now, there's a couple of districts that their attitudes have gone down, and they lose students, and they're losing teachers. We can't do that. We can't afford to start losing students. So we have to have a positive going into this, not saying we can't, we're gonna make some cuts, yes, but we have to be able to promote a positive part of this to bring people in.
Well, there's a humanistic approach here, and it's very, very simple. Any of us sitting at this table, or anybody out there, have the humanist interest of saying, if I like doing what I do, I'm gonna do it better. If for some reason I don't like what I'm doing, and that could be because somebody's doing something to me, or my work environment is negative, or whatever, it has an impact on other people. And in our case, we can't afford that because it affects kids. We just can't allow it.
So, but one of the things I just would like to reiterate is and when we look at this, and maybe with your discussions with, Marguerite, is that right?
Yes,
I got the
Marguerite.
name right. Is maybe coming with a little more of a consistent, definition of full-time and part-time. And what does that mean? And what are the lines that separate and so.
Well, that's truly why it's somewhat of a working document. There are things that'll change, but they need to change for a defined purpose, not just for the sake of change.
I agree, and I guess my defined purpose for at least presenting this and then having it as a point of discussion would be to, minimize any other budgetary cuts, program cuts, or any other cuts down the road, or for that matter, personnel cuts. The benefit package is a big portion of the employment, and so if there's a tweak that can be made in there, but it's gonna save personnel, I'm not saying that it is or it isn't, I'm just throwing that out there, then that may be a softer approach to take than to lose jobs. And so, again, we're not at this crossroads now, I just wanted to percolate it to the surface, and that's where we came from, so.
Can I just ask the schedule for, I thought there was some World Cafe meetings planned around benefits.
They're starting in January, we just had that discussion
And there'll be
last night.
community members also.
No, that's for staff.
Well, I'm just wondering then where would, community members have a chance to hear what they might, their viewpoint of how they view, where we're gonna get that dialogue and
Well,
conversation.
the venue for that is right here, just like it is with the budget, because when we start talking about those things, we need to talk about them in an open session on the board, where everybody here wants to hear. So the community has the opportunity to come in and, hear what we're thinking about or what we're doing. And, but I don't know of too many situations where employers go out and seek somebody else's opinion on a package that doesn't affect them, other than how it impacts them in terms of budget and taxes, which is what the board meeting is for, and the budget process. Are you asking that we have community groups?
I'm just thinking through, where we might access as a board, what our community is thinking about, public benefits. Let's not, we know that there's an issue out there regarding benefit packages, and where do we get our information regarding how they might proceed?
Well, I think it's an interesting consideration, but I think everybody already knows how the public feels about public sector employees and benefits. That's no secret. But I think the other part of that is that when they don't work in this environment and know what it takes to keep good employees and those kinds of things, that's a whole nother matter. And I think we have to have all the pieces of the puzzle to do that. And
I guess it'll come out in the budget. I think you've had the answer. That's the only thing that's really gonna drive any major change will be a budget.
And that's been the case every single year. Tammy, every year we look at personnel, what it costs us, and it's a huge, well, it's 83% of our budget. So that's the very first thing we look at, is what money do we have to make sure that we can maintain or improve if we can in that area, and what do we have to do that? And sometimes that may mean we have to cut staff. But I think that has to come after we've taken a look at what kind of savings can we acquire through health insurance, if there's one, wherever they may be. And we don't know where we're at yet. That's why the consultants, I think, after the first year will hit some pretty fast speed in terms of getting information that we can talk about.
Well, and that's, again, just from where I was coming from, come on the board in April, we have, the budget meeting in June, I think it was the first meeting in June. So the first time I had a chance to look at it, I really didn't have any kind of substantive input as for any changes, because I really didn't know what to change. So and then we get this document that we had less than a week to look at. So that's where some of this comes up maybe after the fact, is I'm getting up to speed on this. But is this online? Is this something that's available online? So this is something that anybody can take a look at, and I think we're all on the right page here. I think we welcome feedback and input, and with the understanding that we have excellent employees, we want to retain excellent employees, because that all translates to our children's education. And I think that's really the ultimate